Dr. Tarek, Adra.
Courtney, Munch.
This video is about inflammation because there's a lot of confusion about it. And the confusion is how to treat it necessarily in the optimal way. RICE, rest, ice, compress, elevate, is the most common protocol people hear about. It's a little confusing.
It is.
Because
people don't know how long they're supposed to rest. Does that mean don't do anything? How long do I ice? How do I compress it? Should it be super tight?
Yeah. And since our mission in life is to take away any confusion and make things simple for you, we created a better system. We're going to call it BRICE. And the B stands for?
Brace.
What does that mean?
It means it takes care of both things. It's a little thing that you're going to put on that stabilizes and does a little bit of compression. So you're knocking out two things with one thing.
But more importantly, it does the third thing, which we love.
Yes,
which
it helps with blood flow.
That's right.
Yeah.
Blood flow is important because when you have inflammation, obviously, you want the inflammation to leave the area. So what happens a lot when people used to compress, they would tighten things too hard, and then they block the blood flow. So we found this company called Incrediwear. We're not affiliated with them. We just like their products. And why do we like them?
Because it's very gentle. It's not too tight. It also has copper in it, which helps with blood flow. In general, you want to try to find anything, whether it's this company or something else. You want to be able to slide your little finger in there easily. If it can't slide in there easily, it's too tight.
It's too compressive.
Yeah.
So essentially, if you're old school and you're like ace bandaging all this stuff, that's fine. Just when you do that, make sure that you can slide your pinky in and out pretty nicely. Yeah. Otherwise, you keep inflammation there.
And they have one for almost every joint. They have sleeves, even if it's a hamstring.
Knees, backs.
Yeah.
The only exception, of course, is the foot. If you have like a plantar fasciitis thing, you know, there's not really any good braces we found for the foot, and that's where this comes in. It's an orthotic. You can get them at any pharmacy or Amazon. This particular brand is called Superfeet. We like them because they have one. The orange one is like a pain-free kind of thing. The material changes, but it gives you enough support on the bottom of the foot to protect the arch. And it's very helpful, especially if you have to walk while your foot is inflamed. It will kind of give you that support. And it also compresses some of the tissues so you don't feel as much pain. So that's the B part. Easy. Remember, we knocked the C too. The compression is knocked out with this one. So R?
Rest.
Right. What's the confusion on that?
Because often people are like, well, I just don't do anything. We want you to do active rest. So if, for example, your wrist cannot move in this range of motion without causing pain, that's what you're not going to do. You do not move it in this range of motion. But other ranges, we want you to gently move it.
We want you to move it again because that creates a pumping action to get the fluids and inflammation out of there. We just don't want you to push through the pain.
Right.
So that no pain, no gain in this case is absolutely false.
Yes.
Okay? We want you to move it, but within the pain-free range. That's whether it's your wrist, your pinky, your
knee.
Whatever, anything. Pain-free range movement is okay. So now the ice, the confusion around the ice is what?
Often people don't know how long.
Or they overdo it.
Yeah.
People like come in with like ice brew, like gangrene almost.
Yes.
You know, how long did you put this ice for?
All day.
So what's the ideal time, Courtney?
You want to ice for 20 minutes, 3 times a day, ideally. There are certain areas that you're going to break that up, like the wrist or the ankle. You're going to ice it for 10 minutes and then rest for 10 minutes and then put ice back on for another 10 minutes. So you're getting the 20 minutes, but you're breaking it up.
Perfect. And we knocked out the C. We don't have to worry about it. The elevate, again, it's kind of ridiculous because, okay, fine, you're watching something on TV, you lift your ankle. If that's what it is, or your knee is fine. But you're not going to elevate your wrist or your shoulder. So that's why it's confusing. It's the least important of all of them. In fact, the most important is the B, the R, and the I. And then, you know, there are some supplements that help with tissue healing. We have a little Connecticut curated for that purpose if you like. But otherwise...
And you're doing this for 7 days, possibly 14 days. But in that 7 days, you're not moving on to any other things. You're not trying to strengthen or release any area. You're just giving the tissue time to heal.
That is the biggest mistake people do also once they do all of this, is they kind of jump right back to exercise too early. So if you do this particular protocol the way we described it, within 7 days you should be ready to move on to more of a mechanical protocol. Sometimes it takes 14, but you know, just check it out and see what happens. This will work beautifully.